Good morning, everyone. I want to begin on behalf of Manitobans to offer my sincere condolences to all Manitoba friends and family of loved ones that we've lost to COVID. This has been a tremendously difficult weekend for many Manitobans for our province. And our thoughts and our prayers go out to you during this difficult and challenging time. The surge in positive COVID cases in the Winnipeg region is concerning for all of us, and we are doing everything we can to help halt the spread of this virus and protect our most vulnerable Manitobans. And that is job one. L'augmentation des cas positifs de COVID dans la région de Winnipeg est préoccupante pour nous tous. Et nous faisons tout ce que nous pouvons pour aider à arrêter la propagation de ce virus et protéger nos Manitobans les plus vulnérables. C'est le premier travail. When we were abiding by the fundamentals, we were beating COVID. Then some of us lost our way, and now COVID is beating us. And we need to get back to the fundamentals in order to flatten the COVID curve, and we need to do that now. Since the start of this global pandemic, your government has always taken action to protect Manitobans, all Manitobans, starting with our most vulnerable people. But Manitobans have also, in past days and months, taken action to protect themselves and each other as well, and that is the key. The key when we were doing well was the decisive actions that Manitobans took to do the right things, and that will be the key to turning the curve in the future as well. We've continued to make significant and successful improvements to protect Manitobans and enhance access to COVID testing, to improve contact tracing. I'll give you a bit of an update today. This is not to suggest that we haven't got many more challenges. We do, but we have made some significant progress as a province. We've added, just in the last 2 weeks, we've added 3 large sites, and that's increased our testing capacity by approximately 40%. We will have at least 30 sites in total across Manitoba just in the next few short weeks, and that's going to increase our daily testing capacity, which has increased significantly, as you know, to at least 4,250, and that is a big improvement. A dedicated evening testing site's been established at Dakota Health Clinic, and more are in the planning stages. That Dakota Clinic has served approximately 650 patients since it opened. We've introduced an appointment booking system, and that has actually had more than 10,000 same-day or next-day appointments booked since October the 20th alone. I should mention that the wait times for booking those appointments are less than 1 minute. That has led to very little or no wait times at the sites as well once clients arrive. So this is saving Manitobans. This is important. This is saving Manitobans literally thousands and thousands of hours of waiting, and that is good. Over the last several months, our healthcare experts have worked extensively to build on our intensive care unit strategies, our critical care capacity. And I know that Dr. Roussin and Lynette Siragusa will have more detailed update in a few minutes later today. But we have a plan. That plan has been months in development. It's already being enacted, and it will reduce optional elective surgeries to free up space for ICUs and critical care beds. This is a phased approach, so as we reduce the need for less priorized surgeries, we increase the capacity in our ICUs. And I want to say that because that phased approach should give all Manitobans greater confidence that our services, our healthcare services, are going to be there even when you need them or a loved one needs them. We're in a red situation in Winnipeg today, starting at 12:01, orange in the rest of the province, and we're there for a reason. COVID numbers are rising, and it's not due to a lack of awareness of the issue. on the part of the people of Manitoba. Most people in Manitoba, 99%, I'll say, have been behaving responsibly. They've been behaving in a thoughtful manner, in a considerate manner. Almost all Manitobans have been making sacrifices through this very challenging time, this unprecedented time. But the number of people infected in the lower age category has been steadily increasing, and significantly so. We also know there's a greater likelihood of the dangers now of group gatherings. We're social people, and group gatherings are a danger. As a consequence of our red rules, group gatherings and orange rules, group gatherings of over 5 people are restricted. And that means there's a rule against that, so don't do it. When you do it, you create greater dangers to yourself and to others. We all need to do our part to reduce the number of personal contacts, and I'm going to ask Manitobans for some help right now. Many of you know Dr. Tam. You've listened to her comments and her advice. She said last week that the most significant thing that Canadians can do to arrest the COVID curve and ultimately to flatten it was to reduce their personal contacts by half. Now here in Manitoba, I believe we need to drop those personal contacts by more than that, by 75%. And so today, I'm asking all Manitobans for at least the month of November to consider dropping and acting on this advice of Dr. Tam, Dr. Roussin, dropping their personal contact numbers, because that will assist us in reducing the power of COVID and increasing our own personal power. Group sizes beyond 5 are now totally unacceptable because they lead to community transmission of the virus. And unfortunately, we have an increasing number of reports of not only people having group gatherings, but also promoting them to others. This is totally unacceptable. For example, on the internet, there were advertisements for party organizers late last week into the weekend. There was one huge Halloween house party being promoted on social media on the weekend. Multiple DJs in attendance in the south end of the city. Now that is totally unacceptable. And I have to say, hockey, basketball, I'm a fan, a former player. They're great sports, but they wouldn't be any good if there were just rules and nobody was enforcing them. We have stepped up enforcement, but not enough. Clearly, not enough. And so we're in a situation where enforcement is not keeping up to the need for enforcement. Let's be blunt about it. We had several hundred calls from great Manitobans alerting us to situations, principally group gatherings. Last week, we had 3 tickets given out. That's not acceptable. That's not an adequate deterrent for the things that, like this event I just told you about, that are a real danger to people. So, later this week, I'll be announcing stepped-up enforcement details where we are going to be targeting events such as the one I just described and others, because we need to do more. Stepping up our efforts to make sure that we enforce these rules is important. Fine to have rules, important to have enforcement as well. My mom was a pretty smart, self-made feminist who rose over a lot of challenges in her life, and she had a lot of common sense. And one of the things that our family always remembered about her was her big emphasis on preventing problems before they occurred. She used to, emphasize this to her children, but she emphasized it to the children she taught, too, for over 40 years. And she used to say, it's better to put up a fence around the top of a hill than an ambulance at the bottom. Preventative measures are what can work to assist us. Preventing the actions of those who would put us all in danger is important with proper deterrence. Us taking actions to reduce our contacts is preventative action that we can take as well. Yes, we're stepping up enforcement. Yes, we need to be proactive. Yes, we need to be preventative in our decision making. And so I also want Manitobans' perspectives on another initiative that's been taken in other jurisdictions around the world. It's been taken actually in Manitoba as well. And we are giving serious consideration to it. And as with all of our plans, we make them available to Manitobans for feedback before they're implemented. I want to do the same with this one. We're giving serious consideration to implementing a curfew that would be designed to restrict travel between key hours when gathering sizes tend to be dangerously in excess of the rules, late night hours, obviously. These late night situations in Winnipeg have expanded our number of COVID cases very significantly. According to Dr. Roussin, this is an action that we should seriously consider, and I am seriously considering it now. I want Manitobans to tell us what they think of the idea of a limited period curfew. We hope very short time period is involved here, but this potential measure will need to be acted upon. If Manitobans can support it and encourage it, good. If they disagree with it, I want to hear from you too. So go to Engage MB, tell us what you think about this potential measure, and then we'll get back to you with our decision in respect of this. I want to emphasize that we all need to work on being part of Team Manitoba, frankly. We all need to step up and do our part. When we were abiding by the fundamentals, we were beating COVID. Now, some of us have forgotten about the fundamentals and COVID's beating us. We need to get back to the fundamentals. And if we do that, and I think we can, then we can flatten our COVID curve now. And we need to get back to green for the good of our seniors, for the good of our healthcare system, for the good of our small business people, for the good of our families, for the good of the security of the people of this province. We need to get back to green. Lorsque nous respections les fondamentaux, nous battions COVID. Alors certains d'entre nous ont perdu notre chemin. Et maintenant, COVID nous bat. Nous devons revenir aux fondamentaux et aplatir notre curve COVID maintenant. It is crucial to remember the fundamentals and to follow them, to stay home when you're sick, to wash your hands, to practice good hygiene, to cover your cough, to practice physical distancing always, even while wearing a mask, and to wear a mask, to get your flu shot, and most significantly, to limit your gatherings by 75% over the coming month so that we can turn this COVID curve the other direction. Thank you. Look forward to taking your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you have one preliminary and one follow-up question this morning. Up first from CBC Manitoba, Bart.
Hi, Mr. Premier. Bartley Kivist here. Mr. Premier, why didn't the province ramp up on contact tracing capacity earlier?
Yeah, it's a valid question. I think that the preparatory work that was done with a view to meeting a need that has been exceeded, and I think that's evident. And that's why we'll have more to announce on the specifics, Bartley, but as you know, we're pursuing additional resources there, both from the federal government. I'll be speaking to the Prime Minister later today, just to thank the federal government, actually, for assisting us with StatsCan personnel, and we're finalizing the details on that. And also with the Red Cross, accessing additional resources there. So it's a fair question. I think Dr. Roussin, Lynette Siragusa can probably fill you in on the planning work that was done in more detail than I can. I can only say we're reacting as we see the problem being greater than was anticipated with immediacy.
Thank you for that. What would you say to people who would accuse your government of cheaping out and not having spent money on those resources earlier?
I would say it's a false accusation. We are, from my last numbers, the second highest spender per capita on healthcare in the country, and we have beefed up our resources devoted to COVID and its related challenges tremendously, significantly. So I would say it's a false accusation, Bartley.
From the Canadian Press, Kelly.
Thank you. Now that you're looking at these numbers, Mr. Premier, is there anything you would do different or measures you would have brought in sooner?
I think Bartley just raised one. I think also on the enforcement side, if I was a backward-looking guy, I would say empowering people to do enforcement's fine, but making sure they're actually doing enforcement and issuing tickets is an important thing, and I don't think that that was sufficiently done. But there'll be lots of time for backward-looking and analysis following this. I would simply say we're taking the actions now that need to be taken, and we're stepping up enforcement. We're stepping up our contact tracing resources enormously. We're taking the actions that have to be taken, and I think we have to focus also, Kelly, on the preventative side, and that's where I go with the deterrents. I think the deterrents have to be there. Look, you know, we all know there are traffic police out there, so some of us make sure we drive accordingly. If we knew there weren't traffic police out there, I think the roads would be more dangerous. And I think what's happened here is we've got some folks who think they're never going to get caught, that there's no consequence, and so they're not behaving the way that the rest of us would like them to, or that we are. And so stepping up enforcement is an important aspect of this. We did empower hundreds of additional people, but the number of tickets that's going out is too low in my estimation. We have to make sure that the enforcement is demonstrable and real, and so people actually understand there's a deterrent there for bad behavior.
And you're asking Manitobans for the month of November to reduce their personal contacts by 75%. What do you say to parents who are still sending their children to school where classrooms are obviously a larger size?
Right. Well, I think that we know that the incidence of COVID transmission, as Dr. Russen's pointed out repeatedly in our schools, is due to community activity, and that the school transmission numbers are very, very low. We also know, though, that where transmission's happening, it's happening largely, not solely, but largely due to excessively large gatherings where people are drinking, or maybe there's drugs involved, they're loud, they're effusive, and they're spreading COVID. And they're doing this in numbers that are not permissible under the red or orange rules, for that matter. And so we need to step up and make sure that those types of gatherings are limited. Look, I was in my 20s once, I understand. Okay, we're social people. We want to be out there. We want to be mixing and mingling with our friends and meeting new people. I get that, totally. But right now we have the chance, of whatever age, we have the chance to do the right thing here, limit our social gatherings for we hope, a relatively short period of time, reduce the incidence of possible transmission of COVID, and protect ourselves, our family, our friends in so doing. You know, I've been stern dad repeatedly on this thing, and you know that, and I've been criticized for not doing more. We're ready to do more. We have been ready to do more. It just, frankly, is always disappointing that some people just refuse to get the message. So hitting them in the pocketbook is going to be the way we help to change behaviors. It's my sincere hope that people listening to this broadcast today will finally get the message. But the reality is, people out there handing out tickets and hitting people in the pocketbook is something that we haven't done as effectively as I would like. It's something we must do going forward.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier, Jeff Keel. Will there, with this latest shutdown in Code Red in Winnipeg in particular, will there be any more financial help or direct aid for businesses like restaurants who are now shutting down again? And yes, it's for 2 weeks, but we don't know how long it's actually going to be if case numbers keep going like this, obviously. Are you looking at anything else, you know, beyond what you've already announced?
What we've already announced is the most generous support programs for our size in Canada. We have tens of millions of dollars going out this month alone on wage subsidy supports that don't exist anywhere else in Canada. One of our principal categories of need is in restaurants, and we all understand that with the fears people have about transmission and the rules we brought in because of that, the restaurant and catering industry in particular has really been hurt by this. But they're not alone. It's broad-based pain, and you'd be hard-pressed to name a Manitoba family or individual that hasn't suffered financially or socially as a consequence of COVID. So, 2 points. One, we put hundreds of millions of dollars out there already in benefits that exceed any other province for our size. Secondly, in addition to that, we've reduced taxes, fees, and charges for not just businesses but individuals. For example, by the MPI rebate, we've helped people lower their costs. If you're delivering pizza or delivering food of any kind, you're able to do that at less cost. We've also lowered the MPI premium. We've also had tens of millions of dollars go out to businesses in a workers' compensation board rebate back to them. We've eliminated the PST on their insurance costs. That's really important to understand. And we've eliminated or reduced taxes and charges for most businesses across the board for a temporary period, granted, but that's a benefit as well. These and many other programs, programs that have been designed specifically for small businesses, have helped us to lead the nation in recovery. And so we plan to continue with those programs. Our applications are still coming in. And we're going to have an announcement later this week on a possible expansion of the existing programs that will assist businesses even more. But of course, we want to keep our small business community in a position to recover, and we are doing that more than any other jurisdiction in the country.
And do you have a time frame, like what time of day this curfew could kick in? If you could just maybe give us some more detail on that.
Yeah, sure, Jeff. Well, we've made a habit, of course, of having these ideas floated for a few days to give people a heads up, get input from people, and we've made alterations to our plans in virtually every respect based on what we've heard from Manitobans. So that would be the plan again. I would think that at some point later this week we'll announce we either are or aren't proceeding in respect of a limited hours curfew. We'll see what Manitobans think about the action. We're all sensitive to the fact that most of us are doing the right thing, and restricting the freedoms of anyone is a sensitive issue. But we're also knowing that the cause of much of our problem is aberrant behavior. It's people who aren't doing the right thing, and so that's unfortunately what curfews in various countries around the world have been used for limited periods in all cases. We know Chief Glenn Hudson, I note, just introduced a curfew of sorts for Peguis to try to arrest the curve in their community. So it's an idea that's not new, but it is a step that we could take to go a little further for a time at least to assist in arresting the COVID curve.
From City News, Jonas.
Good morning, Mr. Premier. It's Jonas Gilbard from City News. Over the last few days, we have heard from so many doctors in the medical field concerned about ICU surge in the province, concerned about available beds and what the future could hold quickly. Can I get your, idea of where the health system is at, and are you comfortable with the response so far from our health minister and his team?
Yeah, I'm totally confident, not just in our health minister, but in our health leaders, our health experts, and I know that they have been devising over the last number of months in anticipation of the second wave, a plan to address the very issues that the doctors are raising. And I'm totally sympathetic to the doctors' concerns. We've acted, I think they've raised 4 or 5 issues in a letter I just reviewed, of which we're acting on all of them. I would mention too, one of their key concerns was that we take immediate action to limit the incidence of large-sized group gatherings and reduce personal contacts by taking measures such as the ones I'm announcing today. So we are on the concerns the doctors have raised, but I will place my faith in our senior medical leaders. They are the experts on public health, and they are the people that have been doing, I think, a commendable job, and will continue to deserve our faith and respect as they deal with this daunting series of challenges.
And as a follow-up, sir, one of the biggest challenges we're seeing is in long-term care homes. We're hearing calls for immediate action. The opposition this weekend calling for an immediate takeover of Parkview Place. Where, are you at with the situation of long-term care homes in the province? Are you comfortable with the situation and the actions that are being taken?
I'm comfortable with the actions being taken. I'm never comfortable with the situation, and clearly the situation is one that strikes at my heart as somebody who has a deep and abiding love for seniors. I hate to see a situation that creates fear for our seniors. And the reality of it is horrible. But the reality is also that the actions that are being taken are designed to prevent and correct and address the situation, and they're thoughtful actions, and they're taken on the advice of leading health experts. And so it doesn't do any good to say it's worse somewhere else. We want to see it addressed here, and I believe the actions that have been taken are starting to see really positive results. As far as opposition parties are concerned, there is a risk for them. They, in making these suggestions, which they have demanded changes on, they are departing from the public health experts' advice, and this doesn't serve our purpose. We're Team Manitoba, and I don't see any doctors on the NDP benches, so suffice to say, I have more faith in our public health experts than I do in opposition politicians at this point in time, with the greatest of respect to them.
From the Winnipeg Free Press, Carol.
Good morning, Premier. The letter that you referenced from the doctors suggests that Dr. Roussin is not being given the budget nor the resources to adequately protect our population from the virus. What do you say to that?
I'd say that's false. I was asked that question earlier, and the same answer goes now, Carol. Our allocations of resources are, frankly, expounding and compounding as we speak, and they have. We started the year with a budget that was $500 million higher than the previous NDP government ever allocated for health. This notion of cuts is false. And the fact of the matter is that we are extending resources in significant number at the request of leading health experts in every category that was referenced in that letter.
And why is your government introducing major legislation right now that deserves a lot of attention, a lot of care and debate, at the same time as we're facing a health crisis with doctors saying we're in grave peril?
Because we can walk and chew gum at the same time, and because the province doesn't stop operating just because we have COVID. We have a number of unaddressed issues. We're cleaning up on a number of fronts, things that were handed to us after 17 years of neglect, and we are making sure that we're addressing those issues over time and giving people the time and the opportunity to engage in debate and participate in the construction of positive change. In other words, I guess, Carol, I'm saying we're moving forward, not just on COVID, but we're moving forward on other fronts as well, because our province wasn't built on COVID alone, and it won't be knocked down by COVID either. If Manitobans choose to act appropriately, we can flatten this curve, and that's what I'm encouraging all Manitobans to do today.
From Global, Brittany.
Good morning, Mr. Premier. Brittany from Global News. You talk about needing to step up enforcement. You've spoken before about adding extra staff to be able to do this, giving more power to bylaw officers, and then in the same turn say only 3 tickets were handed out, which you say is not okay. How do you expect people to take this seriously, that there are actually consequences if people aren't getting ticketed?
Exactly and precisely the issue that we're addressing, and I'll give you more detail on it probably in the next 48 hours, Brittany. But it's clear that talking about enforcement is not the same as doing enforcement. And so we need to step up and must step up to make sure that the deterrents that were supposed to be there are there.
Thank you. And we heard from a number of doctors and ICU workers for the past little bit that have said that we got lucky at the beginning of spring because we didn't have those international flights coming in along with other issues, and said that the only way to get out of the position we're in right now is a complete lockdown. Is that something that's on the table, and if so, why hasn't it happened already?
Well, frankly, it hasn't happened in virtually any jurisdiction in the world, and you're seeing outbreaks in major countries all over Europe, Asia, South America right now. Total lockdowns aren't backed by the science. To equate nobody working in an economy with beating COVID is a false assumption. It isn't backed up by the data. Limited restrictions on group sizes, enforcement of social distancing, mask use, these are the kinds of things that can help and will work. But there's no science that says shut down your economy and you'll get rid of COVID. And that would be an awful price to pay if we had to have everybody unemployed so we could say, well, we took COVID to task. That wouldn't work either. So the two things go together. The improvements in our healthcare system that we've invested in, the preventative measures I spoke about to assist in making sure that we're safer, go hand in hand with having people have the chance to work and get back to the workplace. And that's why our incentive programs, our wage subsidy program, for example, have been so successful. But I would not want people to make the false conclusion that having folks in Manitoba back at work is somehow causing COVID to happen. I don't think anybody's worked harder than our small business sector and the people who work in our small businesses on trying to protect their customers and clients. These restrictions hopefully are short-term pain. That's what we're all after for long-term gain, because the number one thing that our small business people and the people who work in our businesses want is to defeat COVID. That's what they want us to focus on, and that's what we're going to keep focusing on.
From the Brandon Sun, Kyle.
Hello, Premier. In the Prairie Mountain Health Region, COVID cases are pretty low compared to other places in the province. What would you say to people who would claim that residents of Prairie Mountain Health are being unfairly penalized for adhering to provincial guidelines much more so than the rest of the province?
Well, it wasn't, 2 points, I guess, Kyle. I got too much faith in Westman people to think they haven't got the common sense to know that bringing these fundamentals back and making sure we reinforce fundamental behavior is anything but a great idea. The second thing is, we are all of us paying the price for a few people who don't listen. That's what the reality is. And so these rules aren't designed for the vast, vast majority of people in Prairie Mountain or in the city of Brandon or in the communities of Westman or Parkland. The vast majority of people are doing the right things, and it shows in the numbers. But the fact of the matter is we need these rules for the few people who don't do the right thing. And so it is that we are addressing with the rule restrictions we have to put in place to protect all of us. And we also know that people all over this province travel all over this province. And so having no restrictions in one area and lots of restrictions in another is too much of an imbalance and creates the reality that people may choose to move from one area to the other to avoid restrictions, and that may create problems in both areas when they move back, if you're following that. For example, having excessively large gatherings outside of Winnipeg in Westman might allow people to actually take advantage of the rules there and then return back to Winnipeg with the greater likelihood they're bringing COVID with them. That isn't in anybody's best interests. And so restrictions across the province, orange, City of Winnipeg, red, are based on the actual incident numbers and are using the preventative approach that our public health officials have strongly recommended. I'm asking the people in Westman, outside of Winnipeg, to limit their contacts too. Don't take advantage of the fact that you're not in as bad a situation as Winnipeg. That's false logic, and that's in a way what got us the problem that we're in now. Perhaps we were cursed by our early success. Perhaps some of us forgot that these fundamentals matter. All of us need to get back to the fundamentals, right across the province, all Manitobans.
Thank you. And I was wondering if you could provide an update on the $85.4 million that was supposed to go to Manitoba schools to help them get back to business under COVID. It was announced in August, and it was supposed to be implemented in the fall. I was wondering if you could just provide me with an update on that front, if possible.
I don't have it in front of me, but that's okay, fine to do that. I should mention, though, remember, this money represents less than 3% of what the province has committed to education this year. Let's not get hung up too much on the federal government wants to get credit for where it's spending money. I don't think that was the reason the federal government supported this back-to-school investment in the first place. I hope it wasn't. The fact of the matter is we're spending 97+% of the education budget. The federal government's invested 3%, and we thank them for that. But the reality is we won't have any trouble investing the federal money in areas of previously identified priority, and we have added significantly, well over $100 million additional into our education budget already this year, and it was already one of the highest in the country at the start of the year. So we're investing heavily in education and healthcare because those are the priority areas for Manitobans, and we appreciate the federal government's support, but again, it represents 3% or less of our education budget.
From the Winnipeg Sun, Josh.
Good morning, Mr. Premier. I'm wondering, will the province be improving the transparency and functionality of the data released by Public Health on its COVID dashboard, similar to what has been done in Ottawa and other jurisdictions? With more information not help Manitobans make better informed decisions when it comes to the types of things that they're doing out in public?
Yeah, as you know, Josh, I've been advocating this without, I hope, demonstrating any lack of faith in our medical health leaders, our team leaders, our public health experts. I do think we should be erring more on the side of sharing more information with Manitobans rather than less. And I've raised this as recently as today. So we'll just continue to advocate for that to be the case. And again, we're not going to agree with everything our team leaders do any more than when you're on a sports team and you're having a losing streak like we're having right now with COVID. There's a tendency for a lot of players to start questioning the coach, right? I think we got to be careful here that we remember that we've got health experts who have a really difficult challenge, a really difficult job, and to make sure we have their back, not just in good times either, but in challenging times too. So I encourage Manitobans to do that, but yes, I do think that greater transparency would be helpful.
All right. And today you talked about a lot of different things regarding where we are right now, from enforcement to going back to fundamentals and trying to be encouraging to Manitobans what prevented you or Minister of Health or other cabinet ministers from being able to deliver this message in person on Friday, to be able to speak to the public beyond just a press release put out through Twitter and to the media?
We used exactly the same approach on Friday with the announcements on new restrictions that we used when we were reducing the restrictions. Josh, we continue to use the same approach each time that we had a stage of change, and that is to have our public health officials deliver those announcements. That's what we're going to continue to do. That's exactly the way we've done it right up till now, and I don't see why we'd suddenly change at the last minute last Friday. Despite the opposition party advocating for a sudden change in the strategy, that's the strategy that we're going to continue to use.
From CHVN, Taylor.
Hi, good morning. Premier Pallister, you mentioned prevention earlier, and looking at how Winnipeg is currently doing with our COVID situation, how do you think the province did in terms of prevention of spreading COVID?
Well, we did really well early. We're doing not so well now, and I expect we're going to do really well over the next few weeks. As Manitobans reduce their number of contacts and their percentage of contacts, as we step up enforcement, and as our health officials address the issues that are commensurate with additional needs for testing, for tracking, for tracing, as the federal government makes us has more readily made available rapid testing. That's a really important thing I'll be talking to the Prime Minister about later on today. That rapid testing capacity is really a benefit for us, not just at health centers for our frontline staff, where it's really important, right? Because if someone has COVID symptoms, we can test. A nurse, for example, has COVID symptoms, we can test immediately. He or her can get the information back that they're okay or not. The sooner the better, because then they can either get back to work or get the heck home and be safe there. That's important. It's important also to have more rapid testing for our northern and isolated communities so that they're able to protect each other as well. And so working with the feds on, for example, northern Indigenous communities is a really important part of this. So I feel good about the actions we're taking. None of us feel good about having to take them, and I recognize that. But I think that we're stepping up in the right way, and I count on Manitobans to do that. And I also know that for those who aren't, that we have to have real enforcement and real consequences for them, because that is part of solving the challenges that we must face together as well. Thanks to everybody.
And there are a lot of people who disagree with the restrictions, either wanting more or less restrictions. Why should Manitobans continue to follow them as is?
While you were speaking and cut you off, my apologies. Go ahead again.
There are a lot of people who disagree with the restrictions right now, either some wanting more, some wanting less. Why should Manitobans follow these restrictions as is?
Yeah, that's a great point, Taylor. I mean, I've had those conversations with people as recently as Saturday, thinking we're going too far, and then 5 minutes later, other people telling me that we're not doing enough. You know, I can only say, I think we're balancing the need of people in the short term to take the immediate actions that must be taken to assist in improving the wait times on testing, making more testing available. We're at all-time highs now on our testing, but we're also cognizant of the need to address the preventative side. As my mom said, put the fence up around the top of the hill. It's natural for people who are doing the right things to have COVID fatigue right now, because they're quite understandably tired of COVID. But if you're really tired of COVID, let's work together as a team and get rid of COVID, get it down, get that curve flat, because we're protecting each other in doing that. And I guess this is the message that we're going to continue to send out with advertising, with the work of the media as an assist, I think, and also clearly with better deterrence than have been evidenced to date. And I think these combinations of things with the staying at home piece, and limiting your contacts piece, I should say. It doesn't mean you can't go out for a walk, and the forecast for this week should encourage people to do that. But the fact of the matter is that limiting your contacts with others is really going to help us to stem the tide of COVID and bend that curve back down the way we need to do. Say thanks to everybody. Appreciate it. Please wear a poppy in respect of our veterans.